Did you know your overall health depends on a microscopic layer most people have never heard of? The Glycocalyx? Welcome to the future of vascular health. Healthy Vessels, Healthy Future, the podcast dedicated to uncovering the hidden science behind vibrant health, longevity, and vitality. Brought to you by the Glycocalyx Research Institute, each episode delivers cutting-edge insights into microvascular health, empowering you to finally understand why you might be experiencing fatigue, brain fog, or poor circulation, even when your labs seem normal. Through actionable advice and expert interviews, you'll learn how protecting your glycocalyx can significantly improve circulation, support your heart, enhance brain function, and prevent serious vascular issues before they begin. Tune in weekly and discover how healthy vessels today create a healthier, brighter future tomorrow.
So this plot shows you, based on different risk factors. So they have like a European Heart Score that includes your age, your gender, and that sort of stuff, some known risk factors, or whether people had developed new onset diabetes during the 6 years follow-up, or whether it was a family history of cardiovascular complications and disease, whether they started using ACE inhibitors, so blood pressure control medication, or cholesterol lowering drugs. When you develop diabetes, those people had a high risk of a complication. So on the horizontal axis is the relative risk of getting a heart attack or a stroke compared to people not having diabetes, for instance. But the strongest parameter predicting correlating with risk was that PBR parameter, so glycocalyx risk parameter. And the curve they made showed you have sort of a cutoff value of 2.1 in healthy individuals, and people with a value higher than 2.1 or more glycocalyx damage had a 5 to 6-fold greater increased risk of a heart attack or a stroke compared to people with a healthy glycocalyx or a healthy microvascular system. So what it comes down to, in a simplistic model, we mean after 57 people, but 50 people, a little bit more than 50 people, could be identified 6 years before they got a heart attack based on measuring their glycocalyx health. In addition to the conclusion of their study, they said that glycocalyx damage or measuring PBR is an independent and additive predictor of major adverse cardiovascular events in subjects without cardiovascular disease. And the different models, so they use different models to correct for your cholesterol levels, or whether you have diabetes, or whether you're a little bit older, or whether you're a male or female. So depending on the models they use to correct for all the risk factors, additional risk prediction by glycocalyx damage was about 5 to 6-fold more. So people with a broken glycocalyx, damaged glycocalyx, have a 5 to 6-fold more risk of a heart attack or a stroke than people with a healthy glycocalyx. And even more important, if you do correct for all the other risk factors and just look at the effect of glycocalyx, so you only look at people that don't have high cholesterol, that don't have diabetes, or that don't smoke, then the added value, what they call the net reclassification index, so those are the percentage of people that you could not identify in any way else with any of the other risk factors, depending on the models they were using, is about 28 to 38%. So you can identify almost 30 to 40% more people that are at risk of getting a heart attack or a stroke just based on your GlycoCheck, glycocalyx assessment that you could not identify in any other way. So with this, I'd like to thank you for listening to this presentation. And I think if people have questions, then I think Joelyn will be the one that sees those questions and can actually transfer some of those questions to me.
I will keep an eye on the chat and see if there's any questions. But I would say, Hans, the thing that is most striking to a lot of physicians is that these individuals had no previous cardiovascular factors. And that's what we see a lot of when we use the GlycoCheck device, is that these individuals would not be identified in any other way and on any other manner until getting this test. So it's pretty striking.
That's also what makes this study different than all the other studies done that we did in the past. In the past, we looked at patients that will have increased cardiovascular risk, people with diabetes, people with hypertension, people that are smoking, people with high cholesterol, and then we just confirm that in many of these people, glycocalyx is damaged. But these were all healthy individuals. So if they had some history, they were excluded from the study. These were all healthy individuals when they started into this study, and that's what makes this study so precious to show that indeed, healthy individuals you can identify already years before organ damage will start developing.
Yeah, absolutely. As far as this study, was there anything else surprising about it than the PVR?
Well, yeah, that's the other point. That's what we call the net reclassification index. So they really looked at the added value. So it's okay. You would expect in the same people that have those risk factors like high cholesterol or increased blood pressure or diabetes, because of the other studies that we did, you would expect in most of these people that glycocalyx is compromised, and that just correlates with the other risk factors. And if that's just the case, it wouldn't have any additional value, because you would have seen the same prediction of risk by just looking at whether they have high cholesterol or whether they have diabetes or whether they have high blood pressure. But it shows actually that if you only look at people that don't have high cholesterol, that don't smoke, they don't have hypertension, so none of the classical risk factors, just super healthy based on their risk profile, that looking at their glycocalyx damage identifies like 30 or 40% of individuals that will get a heart attack or a stroke that could not have been identified by any other risk factor that we know of. So I think that's the most important thing, that net reclassification index of 30 to 40%, that really shows the added value of measuring your glycocalyx. So before any of the classical symptoms will show up, chest pain or out of breath or diabetes related organ complications or neurological complications, years before that will show up, measuring glycocalyx damage will identify people at risk. So plenty of time to intervene. There's some other studies that we also did, not only with Ignatius, but also some other groups. But Ignatius did already some of the clinical trials with specific therapeutics that we have been developing to repair your glycocalyx. And indeed, if you look at the effect of specific glycocalyx therapeutics, you'll see that within 3 or 4 months, you have significant improvement of your glycocalyx and reduction of all kinds of clinical complications. So combined with this study, that would suggest those people that we identified already 6 years ago, if we would have started treating them with glycocalyx specific therapeutics, improve their microvascular health, repairing their glycocalyx, that my prediction is in many of these 57 people that got a heart attack or a stroke, we could have prevented that from happening. But that's the next level of study. So this is the first prognostic study, predicting risk and events. And now next step would be, if we again do a similar study, identify people at risk based off glycocalyx damage, repair that glycocalyx, can we then prevent these heart attacks or strokes? So that will be an exciting next study to do as a follow-up.
Yeah, absolutely. Well, and I'm one of those individuals who, couldn't be identified any other way. Do all the right things, and sometimes
it's hard to
don't
tell.
know
Hard to tell on the outside. Yeah, so we see a lot of people that have a very low risk profile. They take care of their diet. They exercise. They don't smoke. And then for some reason, still their vascular system might be vulnerable. They have a compromised glycocalyx for unknown reasons. And also the other way around. Some people you think have the worst risk profile and their cardiovascular system is in good shape. Their glycocalyx is actually able to resist all these challenges because of smoking or cholesterol or diabetes or glucose levels. And that's also the reason that some of the other studies that people did in the past they did try some of the studies. If you look at the classical risk factors versus people with low risk profiles, if glycocalyx is significantly compromised, and they got some mixed results. Some were clear, others were a little bit unclear. But actually shows that if you just go to the classical risk factor profile and use that as a guideline, not all of these people have a compromised glycocalyx. Some of them can actually, their glycocalyx is strong enough to resist all these challenges, and their vascular system will stay healthy. Other people in the low risk profile group still have a compromised glycocalyx. So that's why those earlier studies were not always clear in their outcome. And this is the first study that did it the other way around. If you have a compromised glycocalyx, now irrespective of your risk profile, will that result in a heart attack or a stroke? And the answer is yes. You have a 6 times greater risk of a heart attack or a stroke if your glycocalyx is compromised, regardless what your risk profile looks like. So I think that's why this study is so super interesting to share with everybody here tonight.
Absolutely. You had talked about therapeutics. Can you tell everybody a little bit about the therapeutics about ReVasca?
As soon as the GlycoCheck system became available and we started measuring Glycocalyx health or breakdown or damage of Glycocalyx, doing all the different tours that we were doing, and I would tell people, oh, your Glycocalyx is not so good shape and your microvascular health could be better, and then they understand the importance. And they always want to know what can we do to make it better. So in the past, we just tell them, watch your diet, stop smoking, do more exercise. And that was not really helpful because everybody knows an individual that does none of those good things and they don't have any cardiovascular issues. Yeah. And then out of the blue, Bob Long, my current partner and friend, called me also about 15 years ago that he was interested in the GlycoCheck device, and he came over and I measured him, and he had a very good score, better than most young people that I measured. And then he shared with me that he started developing specific Glycocalyx therapeutics. So he figured out that some of the polysaccharides that make up Glycocalyx, that heparan sulfate-like molecules or hyaluronic acid-like molecules, you can be found in some foods, specifically in some seaweeds. So Bob identified some of those seaweeds that have Glycocalyx molecules in them, and if you eat those seaweeds, you can actually repair damaged Glycocalyx and strengthen your Glycocalyx and prevent all kinds of vascular issues.
Are you feeling tired, foggy, or noticing poor circulation despite doing everything right? The answer might be hidden in your microvascular health. Introducing ReVasca and ReNeu, 2 groundbreaking supplements scientifically designed to restore and protect your vascular foundation. ReVasca revitalizes your circulation, supports heart health, and naturally boosts your energy by repairing your blood vessel lining, the Glycocalyx. ReNeu complements this by providing deep cellular repair, resilience against stress, toxins, and inflammation, and enhancing your overall vitality. Together, ReVasca and ReNeu offer the complete solution for lasting health from the inside out. Visit glycocalyx.com today to learn more about how these powerful supplements can help you reclaim vibrant health and lasting energy.
So I started working with Bob over the last 15 years. Now we are on our 3rd generation of Glycocalyx natural food-based therapeutic called ReVasca. And in addition to some of the specialized seaweed molecules like fucoidin and ace-mannan and hyaluronan, we added some other ingredients that we know will help protect your Glycocalyx against further damage. So some skin of apples and grapes, some therapeutics that have a lot of polyphenols, that will also scavenge a lot of the oxygen radicals, and then boost nitric oxide production. Some other ingredients will help you to increase your levels of antioxidants like superoxide dismutase that binds within Glycocalyx and that deactivates your oxygen radical levels, and some substrates that help your endothelial cells to produce more nitric oxide when Glycocalyx is stimulated by blood flow. So combined, all these synergistic effects of these different ingredients will repair damage of your Glycocalyx, boost more Glycocalyx production, and will prevent further damage of your Glycocalyx. So we are testing ReVasca now in about 10 clinical trials. Some of them have been published. So there's a study published on the effects on ReVasca on people with COVID, long-haul COVID symptoms. So we showed that we can actually repair Glycocalyx, improve microvascular health. Also, the larger vessels become more flexible, so the stiffness goes down. Blood flow in the heart, coronary flow reserve improves after the ReVasca in the COVID patients. We also looked at patients with psoriasis, an immune disorder of the skin. So these people get immune therapeutics that will help to heal their skin. But if they take ReVasca together with the immune therapeutics, they see a significant improvement of repair of their cardiovascular health. We're doing studies on complications of diabetes. We're doing studies on hypertension. And all of these studies are very supportive of how important repair of your microvascular system is. And ReVasca is a very powerful tool that we can now offer to people to help them support their microvascular health, repair their Glycocalyx, and also hopefully prevent some of the future complications that they might have gotten if they didn't repair their microvascular health.
Yeah, absolutely. And I know we're talking about cardiovascular today, but the number of stories we have about kidney health and a renal failure, it's just...
For some reason, people classify renal disease in a separate category than cardiovascular, also neurological complications like stroke or impaired cognition and vascular dementia. But it turns out it's all related to a healthy microvascular system, like Joe already said in the introduction. It all comes down to a healthy vascular system. If your microvascular system is healthy, the downstream organs, whether it's the heart, your kidney, your brain, your lungs, your muscle, your skin, your hair, everything, your eyes, all these organs depend on a healthy microvasculature.
Yeah. Even dental, we have this test and treat model of using the GlycoCheck, and it's now being used in functional medicine, cardiovascular, dental. It runs the gamut because everything's related to blood. So everything's related to blood flow.
It goes both ways. A healthy microvasculature also contributes to a healthy dental health, and the other way around. If you have like an infection in your teeth or bacteria growing, that definitely will enter in your bloodstream and compromise your microvascular system and cause all kinds of systemic complications because of that. So it goes both ways.
Yeah. Yeah. And right now, I know that some people may have questions about the actual GlycoCheck device. We have it in both research institutions and commercially available. I'm going to tout your services there as the inventor, because one of the things that people absolutely love is kind of that at a glance picture of their health. It's easy to understand what their microvascular health score is, and it's almost gamification. They're excited to do something about it when they see that score and they know what it means, and they can see that it's measured that, very smallest microcapillaries responsible for the most amount of nutrient uptake, oxygen exchange. Between that and the measure of inflammation with the PVR, it's a very impactful look at their health, and they want to do something about it. Like you said, they ask, what can I do? And so we often have them do a baseline score, that initial baseline score, and then, if they need ReVasca or if they're doing something different, it's just great to come back 60, 90 days later and see if what you're doing is working. So we've really had a lot of success with that. And the way you've designed it is just very user-friendly, plug and play. So we have it in a lot of clinics that it's just easy to implement, easy to onboard. Anything else you want to talk about on the device?
That's it. We are making that switch. We did a lot of academic medical center research studies to validate the system in all kinds of different diseases. And now we're moving into individual holistic healthcare or functional medicine clinics to at a much earlier stage, look at healthy individuals and then measure their microvascular health and offer ReVasca at an early enough stage to improve their health and hopefully prevent a lot of organ complications in these individuals down the road.
Yep. And I know a few people had mentioned eyes, hair growth. A few people on ReVasca are chiming in to say, yes, and that's what we hear a lot is, my eyesight has gotten better, my hair is longer, anything, your skin looks better. We've got a few people on here who were touting it the other day that, it's improving every system in your body. So.
Yeah, so having interesting discussions with a few people how to convince people that they should take ReVasca, and instead of trying to explain all the science and explain that it's good for your vascular system and preventing heart attacks and strokes and maybe increase your exercise performance, the other way of approaching it, if it indeed, like you say, and people already are giving some positive feedback, if it improves the quality of your skin and your hair looks nicer and you look more beautiful, if people focus on that, and then as a side effect, it's also good for their cardiovascular health and their heart and their kidneys and their lungs, maybe that's an easier way of convincing people that really something that they should be taking. So that's one way we're going to test if that's a way to get people motivated to start taking the supplement.
Yes. Hey, if that does it, then maybe we'll have to put a label on there that it will definitely increase your chances of getting a date. And, they'll sign up for it.
Yes, clearly.
So we had a question on the ingredients, the ReVasca ingredients. I know you had mentioned, hyaluronic acid, aspanin, aloe, fucoidan, and Connie was asking about soy.
Yeah, there's no soy in it. There is like a soybean-derived superoxide dismutase. So that's a source of the antioxidant. So the fucoidan is a specific seaweed that the structure of those seaweed molecules turns out to be a hybrid of heparan sulfate and chondroitin sulfate, two important polysaccharides of Glycocalyx. So in addition to filling up holes in your glycocalyx, or the vicodin heparan sulfate-like molecule really binds to the rest of glycocalyx and filling up those holes. At the same time, there's one of the ways the glycocalyx is damaged is by excess production of an enzyme called heparinase or heparinase. That is an enzyme that binds to heparan sulfate and then breaks it down, causing damage of the glycocalyx. But because the shape of vicodin is almost identical to heparan sulfate, it has a very high binding affinity to those enzymes. So instead of binding to glycocalyx, now the heparinase will bind to the vicodin, and that actually functionally inhibits the enzyme activity and prevents further damage. And then the hyaluronan has a similar shape and structure as heparan sulfate, except it's uncharged and it's more important for the volume of glycocalyx. So it binds like 1,000 times its own weight in water. So it hydrates glycocalyx and forming a gel. And then the other one, the more recent added ace-mannan, what we relabeled as Vascaman, is from the aloe vera plant. And that's one of the most studied polysaccharides in the world. It's like almost like 5,000 years of history of science on ace-mannan, showing that it has a very important immune support function. So, seeing all the patients with COVID and sepsis over the last few years really triggered us to add more immune support polysaccharides to the mix. So that really complements and adds new functionality to the ReVasca that we hope will benefit a lot of other people.
Yeah, excellent. Well, good. If anyone wants to get a GlycoCheck into their clinic, they can contact us. You get the two of us as a team, so I do a quick implementation to help you set up the device. It's really plug and play, as I had mentioned, and then Dr. Vink does a science talk. So it's very easy to train to get implemented. And the one question I will say that people often get is, how do I make money with this for clinicians? How do I make money with this device? And for us, it's very easy to put this into practice because you can make money right from your current client base. And the other thing is you really are there to help improve patient outcomes. One thing that we didn't touch on was that this is being used in ICUs. It's being used by surgeons to get a good evaluation of that patient health before they go into surgery. Some of those elective surgeries or surgeries that could be pushed out a few weeks benefit tremendously from having that picture of health and then ReVasca for a few weeks before that procedure. So it's really been impactful for a lot of clinicians. If you have any questions, you can email us. You can email to support@glycocalyx.com, GLYCOCALYX. No one gets that one right. Or you can email myself, jb@glycocalyx.com. And we'll send you all the details. You should have a copy of this study. And I think that wraps it up.
Yeah.
Anything else?
Thank you so much, Joelyn. And thank you, Joe and Mike, for supporting us again through Boston BioLife.
Yep, appreciate it.
Thanks for listening to The Future of Vascular Health. Healthy vessels, healthy future. Ready to uncover what's really going on beneath the surface of your health? Take our quick ReVasca quiz today. Discover how well your glycocalyx, the crucial microscopic lining of your blood vessels, is functioning. ReVasca isn't just another supplement. It's a scientifically backed solution designed to naturally strengthen your vascular health from the inside out. Say goodbye to persistent fatigue, brain fog, and circulation issues. Say hello to lasting energy, clear thinking, and vibrant health. Go to www.revascaquiz.com now to take the ReVasca quiz and start your journey toward better health today. Because protecting your glycocalyx means protecting your future.